Hello, good evening, good morning, good afternoon, whenever you are seeing this video. This video is for the people who have one side paralysis of the face caused because of cold exposure or sleeping under the fan, having middle ear infections, and doctor has diagnosed it as Bell's palsy for them, as well as facial palsy can also use this exercise to rectify the weakness of the face. Now, what are the exercises which we commonly use for these patients apart from very significant exercises which can be taught to you by a qualified physiotherapist at the hospital or clinic? So one of the few exercises which I would like to bring to your notice is one that is raising your eyebrow to reach, that is for activating the muscles of your forehead, and raising the eyebrows and frowning. This also helps. Okay, this is frowning. This helps in activating the corrugators, one muscle which is responsible for this particular movement. And closing your eyes tightly. Close your eyes tightly, hold it, release. Close your eyes tightly, hold it, release. So this also helps in activation of the muscles around the eye. Then you can use the activation of the nasalis muscle. So this you can do. Next is clenching your teeth. Clench your teeth. Clench your teeth. Okay, this will also help in activating the muscles. Then blowing, this will help in activating the muscles of your cheek. Then you have another muscle, so these muscles will be activating the muscles of the neck region. And you have another activation of muscles around. Just do the facial expression exercises. Okay, now the words which can be used in order to improvise the facial expression and the quality of muscle function are the vowels, use of vowels. So you can, basic vowels you can use, that is A, E, I, O, U. We have again short vowels, long vowels. These are the newer things which we have, which if you know you can use. And you can use words which has lengthier terminologies like tree, tea, keep. So these all words can help in activating the muscles of the face and mouth region. Tongue, happy, loud. So these are the words which can be used. And then we can also have use of or exercises for the tongue, so that the tongue activation also takes place. So you can push your tongue to the hard palate, pushing the tongue to the hard palate. Then you can push your tongue to the cheeks. Okay, you can push it and you can give the resistance also when you do this activity. So this will also help in improving the function of the facial muscles. And you can also go for draining techniques. So these draining techniques can be done by simply pushing it to the ear. Take it from here, bring it and go back. Take it from here, take it near the eye and take it back towards your ear. Again take it from here, take it back, and then take it back to the ear. Take it from here, take it back, and then take it back to the ear. Now when one part of the face is involved, so you can do on both the sides. There is no harm in that. It is a normal exercise regime which can be incorporated in your day-to-day activities. So this can also help in draining the excess fluid accumulated in the face because of no proper muscle contraction. There can be drainage impedance, so that can also be draining the unwanted fluids from the facial muscles. And then the frequency of exercises should be very frequent, that whenever you're free you can do the exercises. And several other methods of using the straw to blow, okay, using the whistle to blow, using the chewing gum to chew. Okay, these all things will aid in recovering your facial muscles. So just keep in your mind that you have to incorporate exercises on a daily basis to recover from Bell's palsy. Now there are instances that you may be instructed that not to do exercises, which is actually to some extent not right, because if you're not doing the exercises on your face, what happens is there setup of setting up of weakness takes place. So to avoid such instances, you can start doing the exercises provided you are medically stable, in the sense you have severe pain, you have severe swelling and you cannot do anything, then it's recommended to follow the instructions whichever is being given, because otherwise what happens is the pain can aggravate. So anyhow you are being given a course of medicine to subside the inflammatory aspect of the impact caused because of whatever reason may be. There are several other reasons why this Bell's palsy can happen. So whatever may be the reason can be subsided once the medicine is being taken along with exercises, can have a better recovery for the Bell's palsy cases. So it is advisable that repeat the exercise very frequently. If at all you have pain behind the ear region, we do have treatment for that in physiotherapy. So please do come to any of the hospitals or clinics to avail your benefits for exercises pertaining to Bell's palsy. You can also follow these exercises, simple exercises which I have shown. Apart from that, there are many other activating exercises which can promote your recovery much more faster, and it is advisable that you continue these exercises for a minimum period of 12 weeks to 6 weeks to 12 weeks, which will improvise the function of the facial. And moreover, the facial exercises are very good in order to maintain the facial expressions, and you can also include mime, the facial expression exercises, like you have seen mime, right? So those are having too many facial expression activities, so that can also be improved and included in your activities. So you can use any mime and then you can start doing the activities based on that. So I wish this video will help you out in doing the exercises and performing it well. Contact your nearby physiotherapist to have more intense physiotherapy exercises for Bell's palsy. It is advisable to take technical support and advice from expert who is into this profession. That is, approach your physiotherapist. They can guide you really well in maintaining this function. This is Sumiro signing off from Brain and Physiotherapy. Thank you.